Hi, everybody. Welcome to the COVID-19 task force meeting. I'd like to remind everybody that we have an interpreter to help communicate with the families that have trouble hearing us. So when you're talking, if you could talk a little slower and a little clearer so our interpreter can keep up with us, I'd appreciate it. So keep in mind that we do have an interpreter helping us. We've had multiple families in Hammond communicate with us and ask us to do this, and we wanted to do that so that we could properly communicate with everybody in our city. Wow, Karen, you're on TV today. That's great. So I'm going to start off as we usually do with Dr. Frank from Comprehensive Care. How you doing, Doc?
Good. Good morning.
Would you go ahead and give us our latest update? And thank you.
Yep. So I actually have a few things I wanted to talk about today because there has been some things changing. So I want to get. There's been a lot of questions that I've had about usage of masks. So I want to cover that as well as some of the new testing information that I have, some of the contact tracing, and then there's developments from vaccine and therapies as well. So I'll try to keep them succinct. I want to show you guys, and I don't know if you guys can actually see this, and I can send it. It's a graphic, and what it says, what it shows is the benefits of wearing a mask. So early on in this contagion, we were giving guidance based upon the information we had, and I was not recommending anybody wear masks. This was very early on. The reason for that is because masks, if you think about surgical masks, when surgeons wear them in the operating room, they're to protect the patient from getting infected. And that's typically how we look at things under normal respiratory situations, respiratory infections. Obviously, as you know, I've changed my opinion on that, and this kind of demonstrates why in this pandemic, I believe that is beneficial.
Dr. Frank, could you
look at
explain
the
that
first
for
one, if you guys can see it, I'll explain it. If you have a COVID-19 carrier and they're not wearing a mask, and you have somebody who is wearing a mask, and this is not an N95 mask, just a regular mask, their probability of contracting the contagion, or in this case coronavirus, is 70%. If the COVID-19 carrier is wearing a mask and somebody else is not, their probability of catching coronavirus is 5%. If both the carrier and other people are wearing the mask, that drops down to 1.5%. So what this does, and I can
could you lift that up a little bit so we can see the bottom one? There you go.
Yeah, and Tom, I can send this to you if you want.
For sure.
What this does is it really demonstrates, I think, really well why we are recommending wearing a mask and why at the very beginning we didn't recommend it, wearing the mask, because masks, again, were designed to protect not the wearer of the mask, the persons around the wearer of the mask. We know that this is an extremely, and I'm going to take this down if everybody's okay with that, because I'm.
So let me. So basically, if I am wearing a mask and I say I got a mask on, I don't have to worry about social distancing anymore. What you're saying is, just because I have my mask on, I still have a very good chance if I come into close contact with a carrier of becoming symptomatic, right?
You do. So what this shows is that it's really important for both sides to be wearing the mask. The old saying was, I protect you, you protect me. Well, it's not that old. So what that says is that, it doesn't change the concept that the masks are designed to protect the people around somebody who is ill. But we don't know who is ill, especially with this coronavirus. It's really, really contagious. We're going to find out that it is a very large percentage of the population has been exposed and is going to test positive. What that's going to also do is lower the mortality rate dramatically. So it's going to not turn out to be as deadly. That doesn't change the fact that there's over 60,000 people that have died, which is tragic. because of the fact it's so contagious, we need to protect the vulnerable people in society, because they are really having bad reactions. So I want to throw this out there because I've gotten a lot of questions, and unfortunately some of these things have now become political, which I'm very disappointed to see. There's reason that we have these recommendations, and these recommendations are not going to be in place forever. At some point in time, we will get out there and not be wearing masks and not be promoting these types of things. But now is not the time. We really should do it. So a question was posed about, can you require people to wear masks to gain entrance to a building? That I have to leave up to, your legal counsel when it's a public building. Clearly, private, businesses, just like no shirt, no shoes, no service, you could easily say you can't come in unless you're wearing a mask.
Let me ask you a question.
I've even had questions from my staff about wearing masks. I said, it's there to not just protect you, but to protect the people coming into our building, because we don't know if somebody actually has the virus. Most of these cases are very low symptoms or even asymptomatic. The more and more I've been coming into contact with people who have been positive, and when I say coming into contact, my exposure either over the phone or managing some of these cases, a large percentage of them have very, very mild symptoms. So that's why I really am still a proponent of it. At some point, this virus will go away. All pandemics end at some point in time. They all eventually burn out. So that will happen here. So I still want to push that as we open up society, and I know Governor Holcomb is intending to do that tomorrow, and other states are doing that we still be smart. We open safely. I also saw that the social distancing guidelines are set to expire today, and apparently they're not going to be renewed, which I have very mixed feelings about. Because
I don't know if that's true, Dr. Frank. I mean,
I don't know if it is or not.
Now you're talking about President Trump's social distancing, right? But
yeah.
I don't think it's a foregone conclusion what Governor Holcomb is going to do tomorrow, though. I think, that's something I wanted to talk to you guys about. So I'm glad you're bringing it up, because I'm looking over Indiana. The number of increases in deaths day to day started off in like mid-March with like 2, 5, 5, 2, 3, 4, 7 increases per day. Okay.
Yeah.
And then in March 30th to April 5th, it's 14, 16, 13, 24, 14, 11, 13. Then April 6th through 12th, it's 34, 30, 42, 55, 30, 13, 7. Then in April 13th, it's 37, 49, 41, 42. And April 20th, it's 61, 31, 45, 35. April 27th, 57, 63. 63 people died yesterday. This is going up. It's not going down. I just don't understand what Holcomb's thinking if he releases us right now. It just
I don't know that he's going to completely open things up. I don't disagree, but I know I shouldn't say I don't know anything. From the information I'm getting I just got an email this morning about contact tracing and how that's going to help us open things up. So I'm presuming that he's going to do some sort of opening, and I could be wrong. Bear in mind, deaths are a lagging indicator. So those people that are dying were infected some time ago. So looking at the new cases is important. But the problem I see is that there are so many unreported or unreported positives out there. We're going to have rises in new cases because they're out there. If we get a small sampling of with the antibody test, we're going to find that a large percentage of Lake County is positive. Can you hear me still?
Maximize the window so we could see the interpreter. I'm sorry, Dr. Frank.
Oh, that's okay. I just wasn't sure if I lost you. This is, you're right, Tom. We need to be careful. There's no question about it. We need to be careful with what we're doing. Again, I really think we're going to find out that there's a lot more positives out there, which means the mortality rate is going to go down. And I'm not discounting anybody that's died, because it's a tragedy, no doubt about it. But I think that with that new information, we can look at doing things smartly and safely, which is why I wanted to lead with wearing masks, because that is part of doing things smart and safe. I think the social distancing guidelines should be kept in place. I think that businesses are going to have to make adjustments to how they operate if they're allowed to open, and do things responsibly. The contact tracing, apparently they have a new system for the state of Indiana that's going to take some of the burden off the local health departments to do the contact tracing. That's going to be critical, because if we can identify the positives and trace their contacts, we can minimize the spread. And that's the goal, is to minimize the spread. Because the virus isn't going away soon. So before I get on to developments on vaccine and therapy, do you have any other questions on this topic?
You might, no. Do you have another, you want to have one more before I go to Karen, or?
Yeah, all I was going to go to is there were some new developments on vaccine. I think it was Oxford University had been working on a vaccine for some time before this, based on the SARS pandemic. And they have had really successful results on primates, and they've moved to animal studies, and they expect to be able to release it by September, at least for emergency use. So that is a promising development. Hopefully that ends up happening, which would be a complete game changer. The Gilead remdesivir also had very successful early results, which is also a game changer, because we know people are still going to become infected, but if we can keep them out of the ICU, keep the mortality down, that's a game changer. So I am encouraged as time goes on and everybody is working at these developments, we're getting progress. So I am optimistic. I really am optimistic.
All right. Thank you very much, Doc. It's good to hear from you again. We're going to go to Franciscan Healthcare Center, Hammond. Karen Callahan, who's the director of ER nursing. I got you right? Nope.
Manager, just a plain old manager of ER nursing, not a director.
Thank you, Karen. Karen and Dr. Frank lead off all of our meetings, so we'll go ahead and get a report from Franciscan and see how we're doing there.
So 2 things real quick. I love the no shirt, no shoes, no mask, no service. I 100% think that should be now until, you're right, till this eventually goes away. The other thing is, the most important thing I think that Dr. Frank made the point of was that asymptomatic carriers are shedding the virus, but if they don't have a mask on, they're shedding it to everybody. And he is right. There's a lot of people that have had it. If you think about like maybe December, January, you might have felt like you had the flu, you could have had it, but we won't know that until the whole antibody thing comes. But it's so important. Those masks, I 100% agree. I saw that, actually have that printed for staff in our staff lounge. So the other thing is, a lot of people come in with abdominal complaints. So nausea, vomiting, diarrhea, because this virus kind of attaches to something called an H2 receptor in our body, where we have those the most is in our lungs and in our GI tract. So a lot of people that present to the ER are complaining of those abdominal complaints, and they test positive. Even though they have no lung issues, they're not coughing and droplet spread, they are still shedders of the virus. So just to kind of agree with him about the masks. So last week or Monday, I had said that they started surgeries this week, but I apologize. It's going along with Governor Holcomb's, it's next week. Now, the thing that happened here in Franciscan, Hammond has 27 positives as of yesterday at 4 p.m. and 13 rule outs. So our rule outs took a little bit of an uptake. But more importantly, the Munster campus is now has more positives than the Dyer campus. So they may flip-flop the start of surgeries to start at Dyer on Monday as opposed to their original plan Munster on Monday. So they are watching the curve as well and see where we're having the dips. Hammond has not really, they've had a steady decline, but we're kind of still at a plateau here in Hammond.
Since we're talking about it, let me insert real quick here, Karen. Sure. From the Lake County Health Department, we had numbers as of yesterday. We didn't get today's numbers yet. 277 positive cases in the city of Hammond, tied to our zip code, and 10 fatalities. an increase of 13. Basically, since the last time we spoke, we've increased 40 positive cases. Nobody's died, but it seems to me we're still going uphill in Hammond.
Yes, I would agree. I would agree. And so you know, and so the city knows, I guess, anyone that passes away in the ER is still swabbed, and that information goes to the health department. So just so families will know and that type of thing. What else did I want to? I guess that's really kind of all from me. Just hope people remember that hope is still the only thing that's stronger than fear. So we have to just keep hope that all of this is going to go away and sooner than we anticipate.
Look,
and that's
Karen,
all I have.
One thing that's important to me is when we first got into this, you know, the shelter in place and the rhetoric coming from government, myself included, from, you know, the state government, from the national government, was this is a disease that can overrun our healthcare system. If we don't flatten the curve, you're going to have to make horrible decisions about who gets the ventilator and who doesn't get the ventilator. And I know that that's not the case right now, which is wonderful. You feel like, you know, last time we spoke, I believe you said we were around 40% vacancy still. Is that still accurate?
So right now, I think the volume today was 87 patients, and we have capacity up to like 150. So, and not all of those are COVID, but so that's whatever percentage that is, that's where we're at today. We have never had an issue with a concern about ventilators here in any of the Franciscan campuses or community or anywhere. So just so people in the community know, that's not been a practice here that has happened in New York. There's no fear that we have run out of ventilators or anything like that, just so people are.
So I'm going to ask you the same question I'm about to ask Dr. Frank. Do you think that we've been successful flattening the curve? And I'm not saying, do you think we should go back to work? I'm just saying, have we been successful at flattening the curve, in your opinion?
I do. I agree that we have been successful. And I'm going to be honest with you. My fear of opening up completely on Monday makes me very nervous. Makes me very nervous.
I appreciate that. Okay, Dr. Frank, can I ask you the same question? Do you think that we flattened the curve? And, you know, Karen said, yes, I believe we flattened the curve, but she's nervous about opening up on Monday because maybe we start reversing the gains we made. How do you feel about that question?
So I completely agree. We have flattened the curve very successfully. Bear in mind, flattening the curve also means you've extended the time frame of this. So I have reservations about how we open. I'm personally supportive of opening in a responsible, safe manner. If we don't do it responsibly and safely, we could end up with you know, more significant issues and a significant rise in positive cases. So, you know, it's all about how you do the opening, in my opinion.
And I don't know if, Mayor Tom, if you have data related to the counties, but to me, that would make the most sense, is like the 25% opening of the elective surgeries. That's a smart, safe, slow progress. Yes, we need the economy to ramp back up. We all realize that, but it's the safety of employees, it's the safety of new patients. And if it's, I agree with you, Dr. Frank, if it's done slowly and correctly, I think it would be a good thing. And it would make people feel better, you know, because there's that light at the end of the tunnel that things are getting back to normal.
Okay. Yeah, and you know, the thing that, to me, to bear in mind is at some point we're going to have to open, you know, and the virus is still going to be there. So if we can do it in a slow, controlled manner, as Karen said, and you give people some hope, I think we can be very successful at it. The first thing to do would be, you know, to have all this pent up anxiety and then just say, okay, we're open because the cases are really low. Well, the virus is still out there. You're going to have an even probably worse issue if you do it that way.
Yeah.
Okay. Thanks, guys. I'm going to get an update from the Hammond Police Department. I got my Assistant Chief of Police here. I'm going to socially distance and let them come in here a little bit. Come on in, Andy. Why don't you give an update from the Hammond Police Department? Focusing on positive cases, anybody off work, PPE, anything else you feel is important?
As far as PPE, we have got 1,000 masks earlier this week or late last week. So we got more than enough supplies to last us for about a month. In regards to a positive case, we have one guy who went to go get tested yesterday. His daughter came in from Michigan, stayed with him for 2 days. So he went and got tested yesterday. So we're waiting on the results in regards to that. Other than that, we're doing fine.
How about crime trends? Well, I mean, are we experiencing less violent crime, more violent crime, about the same? I know that we're getting some more larceny and property crimes than we're used to. Could you talk a little bit about trends?
Well, we got some intel yesterday in regards to probably a crew that's coming out of Illinois. It's been coming over here. And we've been watching them. We know what vehicles they have. So we're just waiting for our cameras to maybe give us an identification on them as they come through, and then we'll jump on them from there.
But that's more property crimes?
Mm-hmm. But we also, the domestic violence crime has picked up a little bit. You know, everybody just not in love right now.
Right.
Yeah.
6 weeks of togetherness.
I continue to turn.
Right.
Yeah.
So more domestic, more property types of crimes, but how about violent crime? I mean, I know the big one, we haven't seen any of that,
No,
fatality, violent crime.
We're doing good.
But like you guys, I mean, is it nighttime or is it noticeably less busy at nighttime than usual?
Well, I think during the afternoons, we would get some of the crimes that you're talking about going into probably the 9 or 10 o'clock at night. But other than that, we're doing pretty good.
Okay.
Very good.
Thanks, Andy.
Mm-hmm.
Andy's the Assistant Chief of the Hammond Police Department. I'm going to go to Deputy Fire Chief Kevin Margraf for an update. Yeah. Hi, Kevin. How you doing?
I'm good, doing good, Mayor. Thank you.
Could you give us an update? I know you had a fire this week, which has got to be interesting when your guys have to worry about PPE and not catching a disease and putting out a fire. Did everything turn all right? Nobody got hurt in the fire?
No, there were no injuries. It appears to be a fire that was set on purpose.
Really?
It does. But yeah, for that hour of time, the social distancing kind of went away for us for a little bit, because obviously you have to be in close proximity to the guy that you're working with.
Mm-hmm.
But those situations are minimal right now, which is really good for us and good for the city. That's probably the first fire of significance we've had probably in 2-3 weeks, maybe a month.
Right. So you've noticed significantly less fires? I mean,
oh, absolutely.
Everybody's home, right?
Which is even more ironic. But that's a good thing.
Yeah.
All these folks were home as well.
Mm-hmm. Well, electrical or not?
No, it seems to be the police department's involved. I'll just leave it at that.
No problem.
I would say also that both of the positive cases that we've had, both those individuals are back to work. One was at work for his first day yesterday, and the other individual that has been gone just about 30 days will be back tomorrow.
So nobody's off after tomorrow?
Well, we do have one individual, although he has tested negative, he's still running a fever, so we're being cautious with that, not knowing what the outcome might be, so he's still off, which is, we're just trying to be cautious about the whole thing. And actually, as of yesterday, we have one civilian that's off, and we're awaiting to see what the results of someone who she come in contact with tests out.
Gotcha.
So all in all, we're still doing pretty well for as long as this thing has gone on. So we've probably had 10 cases, 8 negative, 2 positives, and that's a good thing. Supplies were good. We're every bit of a month good, maybe a little bit more than that in the PPE that we utilize. You just got an updated list of the positive transport that the fire department has made, which was 2 within the past week. I think there's maybe 18 total since this has started. These are patients that we have transported to the 3 hospitals that we service. Outside of that, again, the doorstep process, that's something that we utilize. Again, if we're able to talk to you on your porch and through conversation make you understand it might be safer or just as simple for you to take yourself to the hospital versus a medic unit taking you, it works out for both parties that are involved in that situation. And people, they do realize and they understand, and sometimes they'll take themselves. Generally for symptoms associated with the COVID-19 coronavirus.
Mm-hmm.
So again, the fire department and all, you know, we're doing well. We are.
Thank you. I
Thank
appreciate
you.
it. I want to have a quick discussion before we move on and talk about City Hall about what is closed right now, because there's a lot of questions about what if Governor Holcomb says we open up on Friday? What does that affect? Because quite frankly, if I want to go get groceries in Hammond, I could go right now. If I want to go to Cabela's and buy dog food, I could do it right now. I mean, you could go to a lot of stores in our city. The closed things are the churches are closed. That's a constitutional issue, which is interesting. You got government's closed, schools, county, state, city are closed. What else? I mean, even pawn shops are open. Churches, schools, government, beauty shops. Thank you. What else?
Restaurants.
Thank you. Dining for sit down. Restaurants for sit down, of course. There's a lot of carry out going on, but that's a fraction of what they normally do. So Governor Holcomb, let's say, so I think we've covered most of what's closed, most of our, you know, big industrial, I guess, right? Like big industrial plants that, you know, like the steel mills are laying off and stuff like that. But if he comes out, the only thing I really see a sticky point on this is if he comes out and says the state's open, I tell you what, we think we had a problem with churches a month ago. The churches want to go back. I mean, that's going to be the first thing you see if Governor Holcomb opens the state. And then it's going to be mayors standing up to a church. And churches have a First Amendment right to assemble. I mean, this is, you know, let me ask Karen and Dr. Frank. Karen, what do you think about churches getting back together?
Well, if they can social distance in the pew, you're laughing, Dr. Frank, but if they can social distance in the pew, and churches have a lot of passion and they hug and they shake hands to their visitors. And I don't have anything against churches. I love churches. I'm worried for their safety. So if they can do it, again, safely and appropriately, but that's going to have to be, they're going to have to make a plan. I know a lot of them are online, right? They've had some virtual Zoom meeting type things. If they can stay that way for a while, I don't know. What do you think, Dr. Frank?
I certainly don't want to dip into any constitutional issues. It's not my place. But I agree 100% with what you're saying. I think that most of them will try to do the best that they can to do it with the font. And I think just majority of Americans are responsible people. You're always going to have someone who's speeding. You're always going to have somebody who's going to rob a bank. You're always going to have someone that's going to commit a murder. So of course, there's going to be people that break those rules, whatever they are. But I think the majority of people want to get back and will follow the guidelines. And you know, we just have to try to have that conversation with the church leaders and ask them to do that and put those things in place. Because sooner or later, there's going to be a constitutional challenge, like you said, Mayor. And you know, I don't know how you're going to keep them closed. So
I don't want to be, you know, Catholic Church versus City Hammond and Mayor McDermott. I have no desire to be, you know, a First Amendment suit over the First Amendment.
Nope.
You know, one thing we forgot to mention was gyms. You know, Planet Fitness, YMCA, our healthcare facilities in the city of Hammond. Mark Hines, can you unplug? I see you're on here. I don't think you have a video on though. Can you hear me, Mark? Good. Hey, Mark, how you doing?
I'm doing okay. How about you?
Oh, look at that. You have video.
I do.
Sorry to wake you up.
That's all right. Been listening.
Could you update us on what your opinion is if we're allowed to reopen on Friday? Would you feel comfortable opening the Sportsplex? Would you feel comfortable opening the Shepherd Center, the Civic Center, the pool, all that stuff? What's your opinion on that?
I think you have to look at things. We in the Parks and Recreation Department, you know, trying to define us as an essential service, even though myself and others in this field try to always do that. Realistically, we can be shut down. We're a choice department. People can choose to use us, or they can choose not to use us. But if I don't think it's mandated that anyone have to use it. It's not life or death that people come to a park or come to a Sportsplex or things like that. So I think, you know, if we're still combating this, I think the idea about reopening is to try to help those people who are really hurting economically, and us reopening while there's a few, some part-time jobs that'll come back, and I'm sure those people are hurting right now that normally work for us, but I don't see the benefit for a week or 2 or 3 here to open us up just so people can go shoot some hoops or kick a soccer ball around or walk around the track or work out. I think that there's some of those businesses that have the memberships, those are a little bit more challenging. The Planet Fitness types of places, the YMCA, our fitness center at the Civic Center. I was on a call earlier today. Highland has their fitness center at Lincoln Center, and they're talking about every other machine has to be down at least at a minimum, because most fitness centers pack in their machinery. They're so tight. You're going to have to reduce that. But I think at that point, I think the pressure that the governor, that the federal people are getting is because it's about people needing to work and needing to make money. I don't see the urgency of us in our department having to do that. And a secondary one in the state, the phases that that the White House put out, it does show not till the second phase to have any youth sports or organized sports. So I think that tends to agree with a little bit of the statements that I'm making. But if you look at our parks right now, just as a reminder, if people haven't heard, I mean, we're basically only open for people to go walking, to run, to ride a bike, jog. We allow fishing over at Dowling Park, up at Wolf Lake. But that's really what we're open for right now. Those individual recreational activities that can be done by themselves. That's pretty much what's out there. And I think that if listening to Karen and Dr. Frank here on this call, I guess kind of just as being on this call twice a week for the last few weeks is kind of pounded it into my head more and more and more. Why make it urgent for us to open up our fitness center? And I don't know if Karen might have any input from their perspective. Obviously, Franciscan is involved with the fitness center down in Cherryville down there, but she might have a comment that way as well.
Thanks, Mark. Karen, could you add to that?
So we have not heard anything. Franciscan Omni right now has been used. Their staff is deployed there to make shields, masks, and gowns. So that's what they're using Omni for. There's no talk right now of reopening Omni. And I think they're kind of staying in line with whatever the government does, but there's no opening for Omni. We have not heard anything. Okay. I may be able to report next week, but nothing right now.
Okay. But first off, Mark said something I think I want to echo, that a lot of us have been on every single one of these calls, and we just started airing them publicly. But I want to take a second to thank Karen Callahan and Frank Masana, Dr. Frank Masana, for being on these calls every two times every week with us. And now that we're broadcasting it out, thousands of Hammond residents and thousands of residents in Northwest Indiana watch this. And I want to thank both of you for taking the time out of your days to help explain this difficult situation to the residents. So thank you very much for that. I'd like to go to Dean Button next, so we can talk a little bit about City Hall and what we're doing in City Hall. I noticed a new desk today. I know that we're making changes in City Hall. Could you explain a little bit about that in anticipation of the day that we do? I don't like the fact that City Hall's shut down. I feel like I'm a bad mayor any day that City Hall's not open to the public. It's my job to make sure it's open, and Dean is helping me in that regards. Dean, could you explain a little bit what you're doing with City Hall?
Certainly, Mayor. Thank you. So we are preparing to reopen City Hall in expectation of the governor's order to reopen, and therefore we have coordinated with a contractor to construct partitions, plexiglass partitions, and lower bases around certain locations, particularly at the security checkpoint. We've proposed that all staff and visitors who attend City Hall starting Monday will come through the Highland entrance. Will be checked for their temperature before they enter the building. Our staff will be provided with gloves and masks for that health screening before they come in. And the first floor security post also has an improved desk and partition to provide some safe protection for the security people. We've also been aware of 2 particular co-working areas that needed some additional partitions internal to the facility that we can't create a space that provides a significant distance, 6 feet apart. So we're constructing 2 other partitions. We've ordered PPE. We've ordered sanitizer and our infrared thermometers for those health screenings. We have signage being prepared by Public Works, and we also have discs, stickers to be placed on the ground for 6-foot separation for the public who approach the clerk's office and the controller's office and the building department, and certainly anywhere else. I have 100 of them to be able to be deployed tomorrow in anticipation of that opening.
Hey, Dean, could you get a copy of that chart that Dr. Frank held up at the beginning of this meeting and make sure that that's posted? I think that's very effective. And
sure. Also, I'm glad you said that, Mayor, because we're also have ordered placards for proper hand washing, so both in English and in Spanish, proper social distancing, and then the street departments put together a sign identifying what visitors will expect to see when they come into City Hall.
all right. Thanks, Dean. I appreciate it.
I'd be happy to post that from Dr. Frank.
All right. Thank you very much. So we'll get that from Dr. Frank.
I'll send it to you.
Thank you, Doctor. Go to Dave Werpel, President of Hammond City Council, for an update from the council. Dave, I know you're on here. I saw you earlier.
How you doing, Mayor?
Hey, what's up?
I'm doing good. So basically, we're getting a lot of questions about the what ifs. If what if the governor opens on Friday? And like you had Mark on earlier, and I've been questioned by some little leagues. Like, are they're going to move forward as is? They're in a tough spot now because they've got signups and trying to get sponsors and all that. A lot of residents are concerned if he just gives a blanket full, okay, let's open up again. Our proximity to Chicago and them being on shutdown for so long, how quick are all them coming over here? The gaming boat is obviously a huge issue as far as what are we going to do if he reopens them and how we're going to protect ourselves. Yeah, all the way from the gambit of I've had council members say, if he lifts the order, are we still going to be able to do the meetings like these through Zoom and the electronics? Because there are some council members that still wouldn't feel safe. If we show up at the chambers in 2 weeks because the governor's order is lifted. And those are the type of questions I'm getting. I don't want to speak for Scott or Janet or who anybody else that if they've got anything they'd like to add.
Sure. I see Councilwoman Katrina, Councilwoman Janet. I see Councilman Scott on there. I'm looking through real quick. Anybody have anything they want to bring up from the council? And we'll try to tackle. Dave had 2 good questions. One about the gaming boats, the other about Little Leagues. We'll address those. Does any other council members have anything they want to cover real quick? And then we'll start answering them.
I think honestly, Mayor, like we've been talking about even in the council chamber via Zoom, was making sure that we're just all properly doing what we need to do across the board for our residents and making sure everybody stays safe. So that's including, in the council chamber, we're not 6 feet apart in there. So if social distancing is important, then I would still suggest that maybe there's 4 there and 5 away, if that's the case, just so we can make sure that we're constantly properly distancing, making sure that we're all staying safe as well, because we're not effective if we're not staying safe.
I love it. In fact, I'm going to go straight with Councilwoman's question to Kevin Smith, who's on there. Kevin, could you go ahead and click on Kevin's corporate counsel for the city of Hammond? I like how you guys flash in suddenly real quick. Hi, Kevin. Councilwoman Katrina asked a real good question about Zoom meetings and open door laws. That's sort of where I'm taking her question is, let's say the governor comes out on Friday and says, it's okay, the state's back opened up. Do we still have the ability to have Zoom council meetings, Zoom board of work meetings, Zoom, because I don't see any time this summer when 9 members of the city council could sit right next to each other on the dais like they usually do. But we have to have permission from the state for that, right, Kevin?
Mayor, first, thank you for once again doing this meeting. These are all, I think, are really, really good and important for people to watch and see government functioning. So for that, I just want to thank you. Directly to your question, Mayor, I think here's what I'm hearing, and there's a lot of municipal lawyers that are participating in some online discussions regarding this and trying to get some guidelines together. So where it sits currently, Mayor, is that the governor has indicated that it is okay for any public body to meet completely electronically. And he also has given the okay to give notice completely electronically. Most of our
during the pandemic only, Kevin?
Well, correct, Mayor. Just remember, so he went from state, only 25 people to only 10 people to one person can be present at a public meeting to no one has to be. So to me, we're going under the direction of the current status of the governor's orders. As if he decides to loosen those, maybe he goes back to one person can be there, or maybe he stays at none. So we're waiting for some direction. Currently, though, it is absolutely legal for no one to be present at a meeting, physically present at a meeting. You can participate electronically as long as you give notice of that electronically, which the city's been doing, and allow the public to either watch it on gohammond.tv, which we allow, to put questions in via email before a certain time, or in some instances to be present on Zoom through for public hearings. So that's what we've been doing. That's what cities and towns across the state have been doing, and we anticipate to continue to comply with the governor's orders. And if he loosens them, Mayor, then we'll comply that way as well.
Okay, so maybe there's like hybrid council meetings, Mayor. Maybe there's 3 or 4 city councilmen sitting on the actual bench and the other 5 are zooming in. I mean, there could be situations like that in the future, right?
Yeah, as long it would be up to the body. So the council could decide based on what the governor's orders are, this is how we're going to proceed, or the redevelopment commissioner, whoever that might be. We just want to comply with the orders and make sure both the boards are protected and the public is, and the public still has access to their government.
Okay, thanks, Kevin. Mark Heitz, could you come back on? I want you, the Council President Warple brought up an issue about Little Leagues. I've been getting lots of questions about this lately because we host huge tournaments in the city of Hammond for travel ball teams. We have a couple of them scheduled in May. We also host, we also have in-house Little Leagues, Little League, Cal Ripken Baseball, and usually opening days at the end of April. We're at the end of April. What are we telling our Little Leagues right now as far as May is concerned?
Right now, a lot of the sanctioning leagues for those are giving them direction. And I've been kind of trying to pay attention to that. So Little League International is giving that for those who are sanctioned through Little League. Cal Ripken for those leagues, Say Soccer, and similar types of organizations. It's the ones that are truly independent that we're going to have to control and figure out when we allow them to come in and so forth. Based upon the phased implementation from the White House that's been sent out, it's looking like not until the second phase of that was when organized youth sports can return. So that would be the earliest that we could even allow them. We're going to have a little bit of a summit between all of our Little Leagues, because I think there is a concern that you don't want to have one cancel and the other ones press through and potentially have kids switch in leagues. We want to support all of them. They're here in town. I think we want to make a collective decision with the public safety and interest at heart at that. I will tell you from the Say Soccer, the Hammond Soccer Club hasn't already informed us that they're not going to have their spring soccer league. They would have already started the 1st of April. So with games, so they've already canceled that. The league that they participate in was talking about postponing, pushing it off in the summer. They normally have 2 seasons. They usually come back with a fall one as well. So Hammond's club, as part of that one, has determined that they're not going to participate this year in their what was referred to previously as the spring season. But we're going to reach out to those organizations after depending on what the governor comes up with and announces on Friday, and bring together a lot of those people to discuss where we move forward for the rest of this year. I know a lot of them base their season schedules on sending their kid, like Little League, for instance, that you back that up from the Little League World Series that's held in August normally every year. Now, if Little League International decides to have that in October and allows them to try to play a season all the way till then that's something we'll have to consider. But that's, I think that what I'm reading more and more across those sanctioning bodies is they're deferring to what the governors in the individual states are calling out for each municipality, each community to do in their own communities.
Okay, thanks. So basically, until phase 2, which could be, so is it safe to assume there's going to be no youth sports in May?
My personal belief is I don't see anything till at least June 1st at the earliest on a youth sports organization, and that's the way that we're also treating it for the indoor youth sports or youth indoor sports at the Sportsplex as well.
Okay, thanks. And then last, I wanted to cover the gaming boats. We had Dan Nita on a couple of weeks ago or a week ago. It's hard to remember. And I've talked to Dan a number of times, and he wanted me to know that all the casinos in Indiana are working together to come up with some type of rules that they all follow during the pandemic, so that if they open up, maybe they don't have food service anymore. They limit the table games to no more than one, two people or something like that. They're all working together to come up with a common set of rules. And the Indiana Gaming Commission, if they approve them, theoretically they could open up. But I don't see that happen anytime soon. I don't think it's happening next week at all. Obviously that has a lot to do with the governor's order and, of course, the mayor's order in the city of Hammond. So does anybody else have anything they'd like to bring up during this meeting before we conclude? Again, I'd like to thank our interpreter. Oh, we have a question? Oh, hey, Mark?
I just wanted to point out, Mayor, if you hadn't seen, the Indianapolis mayor has already encouraged, he's going till May 15th. He announced today. It's on the Indy Star, just as an FYI.
Yeah, I saw that earlier. Yeah, I know Joe well. Okay, and Steely Harper McClellan. That's our interpreter, right? No? Oh, sorry. I apologize. I'll get your name next time. But thank you for doing a great job today. And thank you, everybody, for participating in our Thursday COVID-19 task force meeting. The next meeting is Monday morning at 10:30. I'll see you all then. Thank you, everybody.